Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to the West Texas View. I'm Johnny Lou Avery, and today you're going to meet Judy Warren. You've met her once before. She's the executive director of the Midland Odessa Area AIDS Support Group, and this is a nonprofit organization that is dealing with the issue of HIV and AIDS with both educational and supportive services. And she and her staff go into schools and educate the people there. They also have all kinds of support services. And she was here several months ago, and as we visited, one of the things I particularly wanted her to do was to come back and talk about some of the things she does with young people and trying to prevent the spread of all sexually transmitted diseases, but especially HIV and AIDS. And after that program, I had several emails and calls from young people, and that prompted my urging her to come back sooner than she had intended to. So Judy, thank you so much for coming back today and visiting with us. And I know you just got back from the International Conference of AIDS support groups, and the thing that was so interesting to you, if I'm hearing it correctly, is that you met people from all over the world that are working just as hard as you are to try to prevent the spread of AIDS and the spread of all of the heartache that goes along with having HIV or AIDS. And so tell us what we need to know about this.
Oh my gosh, yes, I was able to go to my very first international AIDS conference in Washington, D.C. in August, and heard some wonderful speakers, and they're all saying the same thing. We want in our lifetime to see an AIDS-free generation, and in order to do that, everybody has to be educated, including and especially our parents today. They cannot help our young people if they're not educated on it, if they don't know that it exists. And the hard thing about that is that we don't hear anything about it. I tell the kids when I talk to them that you don't turn the TV on, you don't hear these warnings that we tell our kids. We tell them about how different HIV and AIDS are. It's different than other diseases. People do have a hard time believing that you can have a virus, have a disease for years, maybe 10 or 12 years.
That lies dormant, and then all of a sudden it springs out.
Exactly, but all those years you're very contagious and you don't even know you have it, you know, and so that's different to other diseases. But we list sexually transmitted diseases for them. HIV is just one of them. We list 8 for them that are very popular, very prevalent in their world today, and each one of them can be very dangerous and even deadly. When we were their age, we had some STDs, but we had 0 that we had to worry about getting if we made a mistake, and we did the same things that the kids today want to do, but we had 0 that we had to worry about getting that could actually kill us. And I list 8 for them today, and they cannot believe it. You know, we've got we've got syphilis back, and
gonorrhea and things that we thought had kind of been
gonorrhea. We
controlled.
Have some new strains of gonorrhea today that are resistant to the medicines. Excuse me. And we've got HPV, human papillomavirus. Even herpes is more dangerous and can be deadly today than it's ever been. So this is important for our kids to know. It's important for them to take it seriously because they aren't hearing it anywhere else. No one hears about it.
And HIV is such a scary and hidden disease that many times parents don't know enough to talk about it, and so if they don't know enough to just give sex education at home, then they certainly don't know enough to talk about AIDS. But one of the things that in looking at some of the brochures and information, and I read this article in the paper that there has been a roadmap, a world roadmap released trying to stop HIV worldwide, but 1 out of 5 people that have HIV do not know it.
That's right.
And so they are just leaving a string of destruction behind them as they're continuing in their sexual path, infecting people along the way.
Right, and I brought this today to share with you, talking about 1 in 5, you know. This is an article that came out in USA Today paper November 26, 2012, just a few months ago, and it is saying that HIV is on the rise today among our young people between the ages of 13 and 24.
13 and 24.
13 and 24. And I don't know if you can see the headline, the big bold, but what they have up there is that most young people with HIV do not even know they're infected. Now, I have been doing this for 22 years. I started this organization 6 months after my brother died because of AIDS, after going blind and losing his mind.
In a time when it was so dangerous for the families, because they would have their house burned or they would be run out of town.
Exactly. We were very fearful. So I have seen this disease go through so many different trends that it's not funny. And I've been saying for some time that it's on the rise among our young people. And different people, even the health department, say, well, we're not having a rise of young people here, you know. But worldwide it is, and it was going in that direction, and now here it is. Here it is. Most young people with HIV don't know they're infected. This is from the Center for Disease Control. It's new data that they put out just a few months ago, and it goes on to say that today in our country, approximately 1,000 young people, the ages of 13 to 24, are newly contracting HIV every month. 1,000 every month.
Of 1 every 9 minutes or something, I read in some brochure.
Yes.
We're going to have to take a break, but when we come back, we're going to talk about ways that we can combat this if we just will. If we just have the will to do it, we can have a generation free without AIDS, and that's on the roadmap. So we'll see you in just a minute with more information about the HIV and AIDS support group.
Stay tuned. West Texas View will be right back.